All right, gentlemen over 50, what if I told you that something as simple as rubbing oil on a specific spot before bed could actually make a difference in the bedroom? I know it sounds like one of those doctors hate this one-trick ads, but hear me out. This is backed by centuries of use and makes total biological sense. I'm Dr. Sophie Morgan, a board-certified urologist with over 12 years helping men reclaim their vitality. Today we're talking about how a simple oil massage can improve blood flow, ease tension, and support stronger erections while you sleep. The science is actually fascinating. Before we dive in, hit that like button, subscribe, and drop a comment. Where are you watching from? United States? Brazil? Norway? United Kingdom? South Africa? Look, after 50, things change. Testosterone drops 1% yearly after 40. Blood vessels stiffen. Your prostate gets bigger, pressing on things it shouldn't. Add sitting all day, stress, extra weight, and interrupted sleep from bathroom trips. No wonder things aren't working like before. But here's the truth. Erections aren't just about age. They're about blood flow, pelvic floor muscle tone, and nerve sensitivity. All three can be improved at any age. You're not broken. You just need proper maintenance. Most guys think their only options are pills or accepting decline, but there's a middle ground. That's where this oil technique comes in. Why oil? As you age, pelvic skin becomes drier and more sensitive. Daily friction from sitting, walking, and intimacy creates inflammation you don't notice until things stop working. Oil creates a protective barrier and penetrates to affect deeper tissues, blood vessels, and muscles. It increases circulation, calms inflammation, and helps tight muscles relax. Doing this before bed leverages your body's natural repair cycle. The oil I recommend is castor oil. It's been used medically for thousands of years. What makes it special is ricinoleic acid, which makes up 90% of castor oil. It's a powerful anti-inflammatory that stimulates blood flow. When absorbed through skin, it reduces swelling and dilates blood vessels. For men with erectile issues, that means more blood flow where you need it. Plus, castor oil clears lymphatic congestion in the pelvic area. If you can't use castor oil, coconut oil works. It's antibacterial and absorbs well. Some prefer almond oil for vitamin E, but castor oil is the champion. You can find it at any pharmacy. Get organic cold pressed. $10 lasts months. Let me tell you about Frank, 68, who came in 6 months ago, pretty defeated. He said, "Dr. Morgan, I've been taking pills for over a year. Sometimes they work, sometimes not. But I get terrible headaches, flushed face, stuffed nose, almost not worth it." Frank was in decent shape. Blood pressure managed, cholesterol controlled, prostate enlarged, but typical. The problem was purely functional. Erections had weakened over 3 years. Confidence gone with them. I walked Frank through this castor oil technique. He looked skeptical. "You want me to massage oil on myself?" That's the medical advice, but he tried it 3 times weekly for a month. After 4 weeks, his voice was different. More energy, more confidence. Stronger morning erections came back after 2 weeks. He went from waking up 4 times nightly to once or twice. Sleep quality improved dramatically. About 5 weeks in, successful intimacy without pills. At his follow-up, he looked 10 years younger. He said, "I feel like I got a part of myself back I thought was gone forever." All right, let's get practical. Where do you apply this? 2 strategic areas. Area 1 is your lower abdomen, just above where your penis attaches. That's over the base of your pelvic floor muscles and major arteries supplying blood to your penis. Massaging here influences blood flow and releases muscle tension. Area 2 is the perineum, between your scrotum and anus. This sits over your prostate, where pelvic floor muscles are most accessible and where the pudendal artery runs. Massaging here reduces prostate congestion, improves circulation, and releases deep tension. Had you heard about perineum massage before this? Drop a 2 if you knew, 0 if this is new. Here's the exact process. Takes 5 minutes before bed. Warm 1 teaspoon of castor oil between your palms. Don't skip this. Cold oil reduces absorption. Do this lying down or standing. Start with lower abdomen. Fingertips in gentle circles just above pubic bone. Steady, comfortable pressure for 60 seconds. You'll feel warmth as circulation increases. Move to perineum. Middle and ring fingers, gentle pressure, small circles or back and forth. About 5 or 6 out of 10 pressure. Not uncomfortable, just enough to feel it working. 2 to 3 minutes here. Some notice immediate warming. That's blood vessels opening, circulation increasing. Others feel deep relaxation through the pelvic region. Both mean it's working. Why nighttime? Between 10 p.m. and 2 a.m., your body releases highest testosterone levels. Growth hormone surges during deep sleep. Blood pressure drops, meaning better circulation. You're increasing circulation and reducing inflammation right when repair systems kick in. The oil works throughout the night for hours. Morning erections are your body testing the system. With consistent routine, many report stronger morning erections within 1 to 2 weeks. How often? Start with 3 nights weekly, Monday, Wednesday, Friday. Commit for 1 month and notice improvements. Morning erections, urinary flow, confidence. Some do well with twice weekly, once seeing results. Others prefer every other night. Listen to your body. If skin gets irritated, dial back. If getting great results 3 to 4 times weekly is the sweet spot. Which frequency sounds realistic? Drop 3 for 3 times weekly or 4 for every other night. Consistency is key, not a quick fix. Like physical therapy, most notice improvements in 1 to 2 weeks, substantial changes after a month. Benefits extend beyond erections. Urinary symptoms often improve. Midnight bathroom trips decrease from 4 or 5 to 1 or 2. Life-changing for sleep quality. Connection to lower back health. Pelvic floor muscles connect to lower back muscles. When pelvic floor is tight, it causes back pain. This massage releases tension. Many report back feels better after weeks. Some notice gym performance improves. Proper pelvic floor function provides better core stability, affecting squats, running, power and lifts. Most significant benefit is psychological. When things work properly, when you're not worried about performance, it changes how you carry yourself. More confidence, walking taller, feeling more vital. Safety considerations. This is not a substitute for medical evaluation. If you have serious erectile dysfunction, pain during sex, blood in semen or urine, see a healthcare provider. This is optimization, not treating serious conditions. If taking blood thinners or have clotting disorders, be gentle or skip perineum area. Increased blood flow could cause problems. Always wash hands before and after. Don't share your oil bottle. If you feel unusual lumps, bumps, sharp pain, or swelling, stop and get checked. Keep expectations realistic. Not pharmaceutical intervention, gradual improvement with consistency. One component of comprehensive vitality approach, not a miracle cure. How to make this stick? Attach to something you already do nightly, after brushing teeth or winding down. Keep oil bottle visible. Nightstand or bathroom cabinet. Set phone reminder first couple weeks. Pro tip, warm oil bottle in hot water before use. Warm oil feels incredible, makes experience pleasant instead of a chore. If you have a partner, consider involving them. Aging doesn't mean giving up vitality. Your body can maintain and improve function into later decades. Just needs right support. 5 minutes, 3 times weekly. 15 total minutes out of 168 hours. To potentially improve erectile function, reduce prostate symptoms, sleep better, feel more confident. $10 castor oil bottle. Minimal time. Substantial upside. Virtually no downside if following guidelines. My challenge. Commit to 30 days. Buy organic castor oil. Block 5 minutes, 3 nights weekly. Actually follow through. Keep a log on your phone. Energy, morning erections, sleep quality, confidence. By month's end, you'll see enough improvement this becomes permanent self-care. Your best years aren't behind you. With right information and consistent effort, you maintain strength, confidence, and vitality into later years. This is one powerful tool too few men know about. If this was valuable, share it. Subscribe for men's health content that goes deeper. Leave a comment. Tell me if you're trying this. Ask questions. I'm here to help. Age is not the end of vitality. Small, consistent actions create real, lasting change. I'm Dr. Sophie Morgan. I'll see you in the next video. Take care.